Hello, my name is Tarryn Connor. My inquiry is the Tasmanian devil facial tumour disease and the effects prevailing on biodiversity and ecosystem services. The devil facial tumour disease, a transmissible infection discovered in 1996. In 2009, it was noted that without the suppression, control or elimination of this disease, the extinction is likely to occur within 15 years. To provide some background, research identified that 85% of the population is infected. Most troubling is the 100% mortality rate once a specimen is contaminated, with death following within 3 to 6 months. The issues with these statistics is that there is insufficient time to build resistance or for the development of a field deliverable vaccine. Research of the disease suggests that changes occur within chromosomes 87T and 53T, causing approximately 17,000 somatic changes. The limited genetic diversity noted in the species adds further complications to these findings. Because of these uncontrollable outcomes, the Tasmanian devil was added to the Endangered Species Register in 2009. These are the factors that propelled my topic of inquiry, and I was intrigued to analyse the ramifications of the extinction of this species. Specifically, the effects that this extinction will cause on biodiversity, biosecurity, and supply ecosystems. However, researchers have documented and concluded that this disease has already caused issues concerning these areas. I also wanted to research the behavioural changes evident since the onset of this disease. These are issues which will affect the overall longevity of the species and may cause issues in relation to their ability to contribute sustainably to biodiversity. My research commenced using prompting questions as posed by Mackenzie and Davis. Also employed was Google Scholar, Wiley and the Curtin Library. I commenced research words of Tasmanian devil in conjunction with devil facial tumour disease, as well as others shown. While these keywords provided strong foundations, the scope was limited to scientific research of the disease itself. Given the focus of my inquiry, issues relating to biodiversity and ecosystems needed to be developed. Therefore, I needed to add further search words to my criteria. Another issue encountered was the different data selection used in each journal. I employed the use of the T-chart, Venn diagram and timeline tools to ensure the research was cohesive and represented by an accurate timetable. To complete this research, further investigations into management and conservation strategies need to be considered, encompassing reintroduction strategies and the procedures taken to replicate and maintain genetic diversity. With review to the Australian curriculum, I would be inclined to commence studies in this area in Year 4, specifically relating biodiversity issues to the science understanding strand, whereby issues relating to animal control can be explored. With review to the science as a human endeavour strand, various conservation management strategies can be interrogated with focus to ramifications to other animal species. Finally, aspects of the supply ecosystems, primary industries and ecotourism could be developed through the science inquiry skills strand. The infection of the spread can be graphed and analysed to identify trends.